everyone, good morning. It's like so early in Queensland now. I woke up at 5 o'clock this morning. I don't know why, because yesterday I had a late afternoon shift. I came home at midnight and I slept like nearly 1 o'clock in the morning and I still woke up at 5. I think that's because I had another 2 morning shifts before that, so I was waking up at 5 o'clock in the morning, then I had a block of 2 afternoons right after, so my body is kind of still like has that habit waking up at 5 in the morning, but I sleep at 1 a.m. you know, so I'm gonna crash soon, but I have my last afternoon shift today. So I was just sitting on my phone this morning when I woke up and I was watching YouTube videos, and one of the nurses, she posted a video about a nursing student giving a handover and how much of anxiety they had, you know, and all of that. And I remember myself and I was like, oh my god, like that was me a couple of years ago, when I just started my diploma of internal nursing. But then I've kind of like got a little bit of a habit and kind of like being calm when doing it when I was at my uni, because I already have experience in college doing my diploma of internal nursing. But seriously, like that feeling when everyone watching you was the worst feeling ever. It's like fear, it's uncomfortable, being uncomfortable, awkwardness and all of that, because like you have your facilitator watching you beside you, right? You have your body nurse watching you and she's probably thinking, hey, you better do it good because I was teaching you the whole day, you better don't screw it because it will make me look bad because I was teaching you all day. And then you have another two nurses watching you because they accepting the handover from you guys because they're starting the shift. And on the top of all of that you have a room of patients watching you as well, and it's usually a room of 2 or 4 patients, and it's really small room, so like pretty much everyone can hear you and see you doing it, and you do it at the bedside table of a patient. So it's like so much. So I understand the anxiety. You're trying to give all the details, you're trying to sound professional, you know, pronouncing all those conditions and medical abbreviations, you know, it's so freaking scary. Okay, so freaking scary. So I thought in this video I'm going to share with you a few tips how I've done it for myself and how I have built a habit and still stay like professional when I'm giving my handover. So I found my ways and I want to share it with you guys. So the first tip for you is, of course, when you start your handover, you will have a printed out sheet, which is a handover from, which will be for you for this shift, but it will have some information of what's been happening through the night, because the nurses at night who are finishing now, they will update some things that maybe was abnormal or whatever happened to the patient, or maybe something will be waiting for them in terms of assessments that has been scheduled urgently through the night or whatever. So it will be all in that handover sheet. So when you start your handover, you will be standing there and you will be receiving a handover from the night shift, or if you start in afternoon, you will be receiving the handover from the morning shift. Okay, so my advice to you is write in every details that are not on that handover sheet. Okay, if it's been a busy shift prior to that, the nurses might not have time to update the handover sheet, so some of the things might not be on it. So just do your entries, just write it in by hand while you receiving the handover. Let's say if someone opened their bowels through the shift abnormally 2-3 times and it's loose, whatever, write it in. Okay, it might be not on a handover sheet, write it in. If someone had a really bad sleep and needed, for example, a PRN, a temazepam or whatever, to help them sleep, write it in. If someone was abnormally in pain through the night and needed analgesia more than usual, let's say, write it in. Or when was the last time analgesia PRN given, write it all in. The reason why you need to do that is that because your shift from then on will be quite busy, and a lot of things are just slip in our minds. We do forget things because we will be multitasking, doing so many things in the next 8 hours that it's normal for us just to forget certain details. That's why my first tip to you is write in all the abnormal things that happened to that patient on a previous shift on your handover sheet. Just scribble them in, you know. And you don't have to write big things, because I know the nurses talk really quickly during the handover, so just like do slide like highlights, you know, like small things that is easy for you to understand. The second thing is during your shift, sorry, so when the morning handover finished and everything, and you started your shift, whatever you will be doing to this patient that is, for example, either usual or unusual. For example, you had to maybe change the dressing for the patient, which was PRN dressing. Let's say it was not due to die, but dressing had a strike, it was some of discharge seen through the dressing, or the dressing peeled off, or maybe the patient went to the shower and the dressing got wet and needed to be changed, or maybe someone has a edema in their legs and the dressing became all wet to die, so you needed to change it. Add it on to your handover sheet. Sometimes nurses forget to put the wound management plan form. You know, sometimes it could be a skin tear if it's an elderly patient went to the toilet, and you know, like a lot of times they scratch themselves on a wheelie walker parts. I don't know how, like it doesn't have anything sharp or anything like that, but they do it somehow, and they come back from toilet with skin tears on their legs, on their elbows, you know, arms and stuff like that. So just add it to your handover that there is a new skin tear appeared, it has been dressed, you know, and things like that. If you found, for example, redness on their sacrum that hasn't been noticed before, just add it to your handover sheet and say that it has been assessed and the skin is blanching, it's not a pressure injury. Like, very good, guys, very good example for you now, which I faced yesterday. So just a quick, I'm gonna tell you really quickly. So one of my patients, he came with GI bleeding. They were investigating where it was coming from, and he had some problems with his bladder as well. So he had blood coming out through his urine. So we've put him through urine irrigation. So we've put the IDC in, we've attached the bags with fluid to flush his bladder out, and we needed to monitor the color of the urine, if there's any like pieces of blood coming out or any texture at all, and how much is coming out as well, his output as well. And yesterday this patient, he complained that it was wet, so his IDC was on the left side and the tubes were coming out from the left side, kind of from his catheter and up to the bags on the pole that it was just by the gravity, given by the gravity, and the left side was like wet. The gown was wet a little bit and the blanket, and I'm like, where is it coming from? So I've never looked after this patient before. He was my new patient. On a handover, I wasn't given anything abnormal or that the irrigation system is leaking. Like, nothing has been told to me. So I was like, I've checked everything, I've changed the blanket, you know, I've looked everywhere, like I've checked all the devices, all the hoses that's connected to the bags, you know, all the tubes and stuff, and like they're all dry. And I'm like, where is it coming from? I said, like, are you sure you haven't spilled the water on you or anything? He was like, no, I'm fine, like I haven't spilled any water. I'm like, okay. So I decided to monitor that, you know. So I came to him a while ago after that, after I've changed everything. Things were dry, and then like after about an hour from my last check, he was like, it was a time for medication, 8 o'clock medication, and he was like, hey, like my sleeve is all wet. And he was wearing gown and the shirt on the top of him, like a long sleeve shirt just to keep him a little bit warmer, and he's a really skinny man. He was just making himself warm, and he was like, all my shirt is wet, and the edge of the wet spot was a little bit yellow. And I'm like, okay, that looks like the urine with the irrigation fluid. So I was like, it's probably leaking somewhere from the tubes, like definitely, because it looks yellow, you know. That should be it. And then like, again, before changing him, I've checked all the tubes, you know, and I'm like, it's all dry, my gloves are dry. I've called my partner nurse, she came, she looked, and she couldn't find anything. I'm like, okay, I'm calling the third nurse for the opinion. I've called another nurse to come. So it's like 3 of us eyeballing the poor patient, like trying to figure out what is going on there, where is this wetness coming from. and we couldn't. So we found one of the clamps, you know, clamps that just close in one of the tubes, and we assumed that it could be from it, but it looks very intact. So I'm like, I probably will put a sticky tape around it just to see if maybe that was the cause. Maybe it's just leaking very slowly, you know. But then we were like, his sleeve is really wet. Like, I don't know, it was just so weird. And then I said to him, okay, look, I'm gonna just change your short and your gown, okay? And he didn't have other shirts to put on, so I said to him, look, we're gonna take the gown underneath off, and I'll give you a clean gown, and if you're still cold, I can give you some extra blankets and a heat pack. And he was okay with that. So I went to the trolley to get the clean gown, you know, and I came back and I started changing him. And when I took all his clothes off, I found that the poor guy, he had edema on his arm here. It was a big pocket of fluid accumulated here that started to leak, and then his left leg, the ankle, was all edematous and swollen, but it was not leaking. So now I understood what was leaking. It was the arm actually leaking. So probably most likely the person has problem with his heart, that left kind of undiagnosed and unnoticed, because I don't know how people could not see that he has edema, you know, because his right side is completely fine. His right arm is very skinny, and you can see a big difference between the two arms, you know. And when someone is elderly, in old age, you know, the skin is very fragile and like a tissue paper, you know, they usually either have big mess or a very small mess, because they don't have that great appetite to eat. So this one was a tiny man, you know, and all that fluid that you can see in his left arm was so obvious. It was just sitting there. You can see it under the skin, because the skin is so thin and like a tissue paper. You can see that. So it started to leak, and of course I've called the doctor right after, you know, to come and have a look at him. So they were out weighing whether to give him diuretics, like the salt pills, to get the fluids out of his body, the excess fluid that shouldn't be there, and outweighing his kidney function as well, to see whether he can have it in the first place. But yeah, something like that. So that was abnormal, and it hasn't been told to me by other nurses. So obviously, of course, I was adding it to my handover and to my progress note, you know. So when I will begin giving handover, I will mention that, okay, this and this has been found, and what has been done. What action did I do? Like, I've contacted the doctor, you know, I've done a progress note to document that this has been found, so they could pay attention to it later on the next shift or the next day. So yeah, so anything like that would be not mentioned to you by other nurses, and you found by yourself in your shift, just add it in your handover so you could tell your next nurses, because it will be easily for you to see all your writings, because the shift is going really hectic, and whatever you have done in the morning you might forget by the afternoon, you know. And also add to it stress when you're giving the handover, a lot of things just slipping out of your mind, because your mind is kind of like in a stress mood, because it's anxiety, everyone watching you, and you can't think clearly. That's why my second advice is, during your shift, always write in anything that you have done for that patient. If the family, for example, have come to see them, if they have been reassessed by the physio and mobility has changed, so just like write it in. If the dietitian or a speechy came and reassessed them and their diet has been changed as well, just write it in, because these things are important, and they have to be updated in a system if the diet has been changed, so the kitchen could prep for them a proper meal for the next time, something that will be for them in particular. So anything like this, just write it in. And my third advice is, you need to give a care of plan for the patient when you're doing a handover. So that would be your last part of the handover. You need to tell them what is the updated care plan, what are we going to do with this patient today, tomorrow, whatever, in the nearest future. So the way to find it is when you're doing your progress notes, okay, in the vanilla folder of your patient, this will be all the progress notes done today by the treating team. That will include your dietitian, speech, if those two are involved, physiotherapist, and will be your treating team, one of the doctors from the treating team. If there are more members of multidisciplinary team are involved, you will see the notes from them as well. So what you do before you do your progress note, or after, whatever, just have a look at the care plan, okay? And this care plan could be put by the doctors at 10 o'clock in the morning, 11, 12, depending what time they came to see the patient. Sometimes they would go to the patient bed and actually talk to the patient and see how they're going. And sometimes they would just come, grab their folder, you know, the blue folder, the bedside chart, and the vinyl folder, and just go through the medication, you know, previous care plans, notes from the other team members, and just, you know, go through and do their own notes. Okay, so sometimes you might not even see the doctor because you're busy running somewhere. They will come do their thing and leave. So have a look at their notes and see what was the current or the latest update for their care plan. It could be that someone was, for example, on IV antibiotics as of today, but now they're planning to change it tomorrow to orals, maybe decrease the dose, or maybe someone was presented with sepsis or some sort of infection, and they were trying a particular type of antibiotic that didn't develop sensitivity to it, so they were changing it to a different one, so it will be in the notes. You know, if someone, for example, is on a plan of weaning oxygen, if someone is on oxygen, came with shortness of breath, you know, but now it's resolving, so the person was on oxygen here at the hospital, so they want to wean it to the room air, so they will put it in a care plan. So for you it will be important to see all the updates, and you look for today's care plan or the latest yesterday, because sometimes if it's a weekend, the doctors might not come to see the patients, and they might not update any care plans until Mondays if the patient is quite stable or whatever reason is, you know. So look at least for the updates from the previous day. And if it's not updated on a handover by the previous nurse, you just scribble in your findings. So say that aiming to win the oxygen to die for this patient to the room air, if the SATs are sitting above 92%, for example, have been changed from IV antibiotics to oral, let's say twice a day. If the physio came and changed the mobility of the patient, just usually they write it in on the board. But again, when you're giving a handover, I usually don't look at the board and stuff. Well, now I do, but when I was a student, like, I would strictly look in my handover because I would be so freaking out, you know. So you might be just looking at your handover, you know, so just make sure that if the mobility of the patient has been changed, let's say from a wheelie walker to a Sarah steady because they declined and therefore mobility, they have weakness in their legs or whatever, just write it in your handover that mobility has been changed from that to that, you know, and things like that. If something has been scheduled, let's say for tomorrow, let's say a scope like endoscopy or colonoscopy, so the team will write that. Let's say if it's an endoscopy, they will write that from tonight, the person will be fasting from midnight. So just add it to your handover sheet. So when you're doing a verbal handover, you can easily read it from your handover sheet. You don't have to rush in to grab the folder. You don't have to ask your body nurse, you know, because of course they will know, but you will have it all written and ready for you to read it off while you're doing your handover. So these are my 3 advices to you guys that will make your handover more easier. If you get lost, if you get really scared, also you can use like head to toes kind of assessment. So think of your patient as of head to toes. So what's been happening today? Head, you know, how they were, maybe neurological obs or just a normal observation are, like, did they Q at 0, did they Q at 1, you know, if it was 1, what was it? Was it a blood pressure elevated or low? Was it a respiration rate? Was it a heart rate? Whatever. Then you go like, okay, the head, okay, how did they tolerate the food? Fine. What diet they are on? Then you're going down to the heart and all of that, and see, depending on the presentation of the person, did the person had like a chest pain today or whatever, did they go well with mobility, going to toilet or to shower or whatever, didn't have any shortness of breath, any pain in the chest, whatever. If there are any ECGs been done, anything like that, then tummy as well, that would be like their diet. Did they open the bowels to die or they haven't? If they haven't, how many days? what has been done. Are they on regular laxatives? Are there any PRNs written, or have they been given, you know, what the team wants? You know, usually like if it's 5 days, we try to give them enema. We don't want to keep them constipated for a long time, but it also depends like how much person actually eats and drinks as well, what age of the person is in, and things like that. And then you go down like your skin assessment. Do they have any pressure injuries? Do they have any dressings that needed to be done? Have they been done before and it was no need to do it today, for example? Is the person on repositioning? Do the person use continent aids, bedpan, you know, do they go to toilet by themselves, mobility and all that? So just like literally go head to toe in your mind if you forget and you get lost, and think of your patients, what have you done to them as well. There is no rights or wrongs when you are a student. They're not going to judge you really harshly, but I know it still adds an anxiety. If you forget to say something, your body nurse will add it up, okay? But if you follow what I have been doing by myself, you should be fine, because like now I don't have any fear or anxiety when I give handovers. I actually like to give handovers. Sometimes we joke when you give handovers, we joke with the patient because they are part of the handover, and you know, like we just joke around when we talk about them during the handover. So it became kind of like a fun, nice process. You still stay professional, obviously, but I don't have anxiety anymore. But yeah, I thought I will help you out a little bit. If you are a student, I'll give you some of my advice. So remember, the advice number one, let's just recap. Advice number one is to do notes from the handover that you're receiving in the morning, adding on to the sheet, to your printout handover sheet, things that are not in there. During your shift, just try to add all the information and tasks that you've done to that patient, so you won't forget to tell about it in the end of your shift during the handover. And third, if you want to do your care plan, just look in a vanilla folder for the latest entries of your treating team to see what changes has been done to the care plan, and write it in your handover as well. And the fourth one, if you get really lost, just go head to toe kind of assessment in your head about your patients, and you should be fine as well. Yeah, if you have any questions, if you want to share your story, how you were as a student doing the handover before, please do share your advices. Tell us what has helped you to become better at your handovers. You know, maybe you're a starting registered nurse or EN as well, and you're kind of like feeling lost. Share your stories here, share your comments, share your questions. It's a community here on my channel, you know, we all read the comments of each other, and it's pretty fun as well. But yeah, thank you for watching, and I'll see you in my next videos. Bye.